Do you really know about heart disease? Well, host Henry Guzman sat down with cardiologist Ted Feldman to test your knowledge.
We're going to put together some heart disease myths, Doc, we got from the American Heart Association. So can we get a drum roll, please? I guess we don't have a drummer here. First myth, if I have heart disease, do I need to take it easy?
Wrong, wrong. Henry, you know that?
I have these pictures of movies from like the 1930s where someone has a heart problem. They're,
sure.
All right, don't move. You know, you have to don't stay still.
I mean, I'm dating myself a little bit, but when I first entered medical school, the treatment for people after a heart attack were 3 weeks of essentially bed rest. We now get people moving in the CCU the day of or the day after their heart attack and procedure. The single most important thing you could do if you have heart disease is to be physically active. Now, in the immediate period after a bypass or a stent or a heart attack, doing that under the auspices of a formalized cardiac rehabilitation program would be highly recommended, but that's only for a matter of about 12 weeks. After that, you're free. But for anybody else with heart disease, risk factors, high blood pressure, high cholesterol, diabetes, stable coronary artery disease, congestive heart failure, the more active you are, the better you're going to do, and the more physically active you are at any given diagnosis, whether it be cardiac or non-cardiac, the better quality of life you have and the more quantity of life you have. So nothing could be further from the truth. If you have heart disease outside of the period immediately after a heart attack, bypass surgery, or a stent, you should exercise and exercise regularly, and even in those specific circumstances, exercise is an extremely important part of it, but it needs to be done in a supervised setting for about 3 months.
Right. So it's a win-win. You heard it. You heard it here. Exercise, you can't get out of it, even if you have, especially if you have heart disease. So the next myth: if I take a cholesterol-lowering drug, I can eat anything now, Doc. Anything. This is great.
This is the old Lipitor cheeseburger argument, you know. There is no question that what you eat and how much you eat is the single most important factor in controlling all of the metabolic risk factors for heart disease, of course, cholesterol being one of the most important. I would be lying to say that if you are on aggressive medication, you can't liberalize your diet a little bit and still be able to get excellent long-term results. Having said that, though, we want to put people on the least amount of medication required, and in order to do that, continuing to follow lifestyle recommendations around healthy eating and regular activity become extremely important. So despite the fact that you are on cholesterol-lowering medications, it's extremely important to be compliant with your diet, remembering moderation, variety, balance. The first thing you don't want to ever tell anyone is what they can eat, because we know
we're kids, we're going to rebel.
That's what we want to eat. So I tell everyone, you know, follow the 90-10 rule. The 90-10 rule being, you know, 90% compliant with an excellent diet and 10% what I like to call treat yourself to whatever it is you like. As long as it's in small portions and not very frequently, I don't think you really need to worry about it, outside of some specific circumstances, let's say in the diabetic population.
Right. So if you're wondering out there what the doctor meant by 90% being good, 80 to 90% really should be mostly plant-based. If you eat animal proteins, make them very, very lean. That's your 80 to 90% should be your diet. So if you're wondering on a day-to-day basis what I should be eating, think of it that way. That's the simplest terms we could put it without getting into a whole new show. So, Doc, third myth: it's okay to have high blood pressure as I get older. I've heard this one a lot, and
well, this is actually very interesting, very complicated, and very much in the news, because one of the things that we've come to realize is that as we age, the systolic, or the top number of blood pressure, tends to go up. So for every decade above 50, the average systolic blood pressure goes up by about 10 millimeters. So if you're 60, if 120 is normal, 130 at 60, 140 at 70, 150 at 80. So there is a general tendency for systolic blood pressure to increase with age as the blood vessels become less elastic. If you stretch an older rubber band, it doesn't stretch quite as much as a brand new rubber band, and the elasticity in the blood vessel walls become less elastic, and blood pressure goes up. What we've come to learn very recently in a very important trial that fundamentally changed how we treat high blood pressure, particularly in the elderly, was the SPRINT trial. 9,400 people, equally divided, one group treated into blood pressure in the 120s, one group treated into blood pressure in the 140s. After 18 months, they had to stop the study because there were a third less heart attacks, strokes, and death from heart attack and strokes in the group treated into the 120s. The moral of that story is just because your blood pressure goes up with age doesn't mean that you don't get significant benefit by lowering that blood pressure from what might be an age-related normal blood pressure. So there's very little that we do in medicine that cuts heart attacks, strokes, and death by a third over a lifetime, let alone by a third over 18 months. The second component of that study was a subgroup of that group went on and continued blood pressure treatment versus not, and there was a marked reduction in memory dysfunction and the development of dementia, not necessarily Alzheimer's because that's a specific form of dementia, as people's blood pressure was more controlled. Now, we're not necessarily saying that blood pressure controls prevents Alzheimer's disease per se, but there's a lot of dementia that's ill-defined that gets labeled as Alzheimer's that may well be vascular dementia related to high blood pressure. So not only do, as we get older, are you better having lower blood pressure to prevent heart attacks, strokes, and death, but you're better having lower blood pressure to prevent the development of memory dysfunction of aging and or dementia. So it's extremely important, and the new guidelines as of November of 2018 is that everybody should have a blood pressure of less than 130 over 80, regardless of age.
And we've got more heart health myths for you. Head to our website, allhealthtv.com. If you have a question, reach out. We'd love to hear from you. You can send us an email by visiting our website, allhealthtv.com, or give us a ring, 855-796-4475.